Osteoporosis can affect these bones that we can find in the pelvis of the human body. This bone over here is the femur, the longest bone of the human body, and it is a truly strong bone. The compact bone in the femur as well as the spongy bone of the femur have an incredibly strong structure that can bear weight that is transferred from the upper part of the body to the sacrum bone over here and the hip bone over here. Osteoporosis causes a destruction of the spongy bone and the compact bone, and thus it can lead to fractures of the human bones that can ultimately lead to death. So let's explain what osteoporosis is, and after we explain what it is, let's explain some possible causes besides aging and lower estrogen levels, and then let's explain dangerous signs we should never ignore. So the loss of bone's mass, microarchitecture, and density is defined as osteoporosis. This weakens even the strongest bones of the human body, and fractures of femur are one of the most dangerous fractures that the human body can experience. But osteoporosis does not only affect the pelvic bones, it also affects this over here. Well, this is not a dinosaur or a reptile. This, what you can see here, is the vertebral column of the human body. So one thing we can do to diagnose osteoporosis in all of those bones is send radiation through those bones, the hip bone, the femur, and the lumbar spine. And then we can measure how much of the radiation is absorbed by these bones. We refer to this examination as DXA, dual energy X-ray absorptiometry, and that can help us define osteoporosis and strike the right diagnosis. Healthy bones are supposed to absorb a lot of radiation, a lot of X-rays. Why? Because they are dense. But osteoporosis reduces the density of the bone tissue, and it causes microarchitecture to deteriorate. Therefore, osteoporotic bones cannot absorb the radiation, and a lot of radiation simply goes through them. By measuring just how much radiation is absorbed in these bones, we can calculate the so-called t-score. And if the t-score is less than minus 2.5, then we have the right diagnosis: osteoporosis. In osteoporosis, t-score is a statistical measurement of bone mineral density. Low bone mineral density leads to fractures. And that brings us to the second way I wanted to explain on how we can actually diagnose osteoporosis. Sometimes an easier way to diagnose osteoporosis is to simply look at an X-ray scan and try to find typical osteoporotic fractures on femur, hip bone, or lumbar vertebrae. For example, a compression fracture of the lumbar vertebrae. But in osteoporotic patients, fractures that look similar to normal fractures can also happen, but this time with minimal trauma while running, and there are also reports that fractures can happen when sneezing and coughing. So, lower levels of estrogen in older age are thought to be the main reason why osteoporotic changes happen and why bones are more prone to fractures. But what if that's not always the case? What if there's something that we're doing or an underlying condition that causes osteoporosis and we don't know about it? But before we explain these secondary causes of osteoporosis, I want to say that there are a lot of people who actually do these things that cause secondary osteoporosis or have underlying conditions that are causing it. Therefore, you can help us reach them by liking this video, and that will make YouTube suggest our videos to other people searching for osteoporosis. But you can also share this video with your friends and colleagues. At the end, if you like our video, you can subscribe for more videos in the future But make sure you click that bell button and then click all, because we noticed that YouTube doesn't really suggest most of our videos to our audience if they don't click on all of these things. But now back to the things we can do that can cause osteoporosis. This, what you can see here, is a list of medications that doctors often prescribe to their patients. Medications that can cause osteoporosis: aromatase inhibitors, gonadotropin-releasing hormone analogs, and selective estrogen receptor modulators can all reduce the level of estrogen, and that ultimately causes osteoporosis, which results in fractures. Corticosteroids, a type of medication that often causes secondary osteoporosis. A healthy bone is constantly resorbed by the cells called osteoclasts and rebuilt by the cells called osteoblasts. This natural process of rebuilding the bones of the human body can be disturbed by corticosteroids, and they can increase bone resorption and reduce bone formation. But besides doctors causing osteoporosis by prescribing medication they shouldn't prescribe or prescribing too much of it, conditions such as hyperthyroidism and Cushing's syndrome could also be a cause of secondary osteoporosis. But how do we recognize and how do we discover these signs that indicate that conditions such as hyperthyroidism, Cushing's syndrome, or a wrong type of medication is causing secondary osteoporosis? Two signs that I always pay attention to when it comes to secondary osteoporosis caused by either medication or an underlying condition are the onset of osteoporosis and the progression of osteoporosis. The primary form of osteoporosis that develops with aging and lower estrogen levels usually develops over a longer period of time, and then after a therapy has been applied with bisphosphonates, teriparatide, calcium, or vitamin D, it slows down. Secondary form of osteoporosis that is caused by medications or an underlying condition develops more rapidly, and then it doesn't respond well to a standard therapy for osteoporosis, but instead it keeps progressing. So those are the two signs we have to look after: rapid onset and therapy resistance. So if you're a doctor and you want to make a video like this one, go to anatomsky.com. But if you have more questions about osteoporosis, then go to this link, symptomsky.com/help/osteoporosis. Well, both could subscribe to our channel.